Welcome back to Carolina Newsmakers. Here's your host, Don Curtis.
We're back on Carolina Newsmakers. Our guest is Democratic gubernatorial candidate or candidate for the Democratic nomination, Ken Spaulding. And we've talked about the economy. We've talked about education. The other thing I think that is on everyone's mind always is the matter of health care and funding of health care and all the things that go with it. So have at it.
All right. Okay. Let me just tell you, be very blunt. I'm in favor of Medicaid expansion. And let me tell you, I had an opportunity to represent Duke University Health System in regard to a possible, and we did succeed in getting a merger with Durham County Hospital. So when the CEO, Ralph Snyderman, asked me if I would represent them and work with them on getting that approval, I learned a lot about the medical area and hospitals and medical bills and all kinds of things like that and how the system works. So I'm speaking from a slight amount of experience, even though I am not a doctor or a health professional. But let me tell you, common sense. When we have our hospitals serving as their emergency rooms, serving as the primary physicians for so many people who don't have the funds to pay for their health care, but they use emergency services, somebody has to pay for it. And the somebody that has to pay for it is either the taxpayers or the bills go up in these hospitals. And then we talk about high health costs. Now, on Medicaid expansion, North Carolina was going to get $2 billion from the federal government, I believe, for the first 2 years with Medicaid expansion. Medicaid expansion, and you know, I'm going to be candid about this, and I'm just going to lay it out there. In my opinion, the Republicans and those who've been against Medicaid expansion, one of the things they've done is they try to make it seem like it's one of those, the term like this, it's just another one of those social welfare programs. That's not the case. They use the word Medicaid, that means poor people, expansion, meaning making it larger, and therefore politically people are looking at it, well, that's just another one of those programs. It is not. The money does not go into the hand, to the pockets of someone that's on Medicaid. No, where the money goes to the hospitals. It goes to the doctors. It goes to the physician assistants. It goes to the health professionals. It goes to the monetary care for those individuals that are getting that treatment. They're getting it one way or the other. The point is North Carolina going to have that money and take that money that has been allotted to us, or is it going to go to some other state? And with that in mind, on the Medicaid expansion, as I said, it is a way in which hospitals, doctors, nurses, and others are able to get paid their fees for what they have done. Now, there's something that they haven't told you, and that is our hospitals no longer are able to get that proportionate fee or money from the federal government that they used to get to help pay for indigent services for the poor, would be reimbursed a certain amount by the federal government. That was taken out of the Affordable Care Act because they expected that states would get Medicaid expansion. So the hospitals are being squeezed both ways. They're being squeezed that they don't get get paid by the patients. They don't have that formula in which they can get reimbursed from the federal government for taking care of indigent care, and they're not getting Medicaid expansion that would allow for the monies to be able to pay for the hospital, to go to the hospitals, the doctors, the nurses, the physicians, assistants, and the healthcare professionals. So they need to take that politics and making it seem like a very good, we're very strong on being conservative and that type of thing, and we're not going to see that there are going to be a bunch of social welfare programs. That's not it. This is health care. The people are getting the health care, but it's making sure that the professionals that are in the hospitals and the others are getting paid their fees. Otherwise, it's coming out of our pocket or our hospitals are closing and people are dying.
Interesting observation is the fact that that you point out where the money ends up. The money ends up in the hospitals, and they will make up for it some other way.
And the money also ends up in our economy. Yeah. Pumping $2 billion into our economy, that helps us tremendously. Right now, because of politics, they are refusing to accept Medicaid expansion because of politics. They don't care about the human compassion, the caring for the people that get sick, that could have preventative care, that just to quite frankly, spiritually, giving a helping hand to those in need. making sure that somebody helping the sick and afflicted. I mean, that's what they teach us in church. And so I'm not saying waste our money, throw money away, but I'm just saying that let's be smart about what we do and not let politics just enter into everything for winning an election when it comes to education, teachers, health care, these kinds of things.
Now, again, North Carolina, as you've pointed out already, and as everyone knows, we've got basically two kinds of health care. We've got the health care in the metropolitan areas, and then we've got some counties that have, some counties have as few as 4,000 people living in an entire county. And there are whole sections where they have to drive an hour and a half to go to a hospital. You
are so right. They've been telling me that as I've been in all parts of this state. These small counties are telling me that we have to drive over this far for a doctor. We have to drive over this far to go to a hospital. Or they're talking about our hospital is going to be closed. Where are we going to go? That's why I say, I say to every North Carolinian, get a chance to enjoy what we used to call the vacation variety land of North Carolina. Get a chance to actually, however, go to the non-urban and the rural parts of our state to be able to see what people are having to go through so we can all understand as we pull together and not divide ourselves so much. We pull together both urban and rural. And in other ways, we will be able to have a much stronger and better state because all of our citizens would be getting much better treatment in not only health care, but also on education and other matters that are so important, and jobs.
We'll turn now to transportation because in addition to a lot of other public endeavors that you have been involved in, you were a member of the North Carolina Board of Transportation from 2005 to 2009. So you know a lot about transportation needs in North Carolina. What do we need to do there?
Well, I'll tell you. I practice what I preach. So what I'm saying here is what I did when I was on the Board of Transportation. I represented urban counties of Wake and Durham, and also had smaller counties, more rural counties and smaller counties of Person and Granville and Vance and Warren counties and Franklin counties. And I told them at my first meeting, they probably said, this little guy is coming in here, is going to tell us what he's going to do already, and he just got sworn in. But I had a chance to speak to the board, and I told them that my division is a microcosm of North Carolina, urban and rural. And one of the things that I'm going to do is, because a good bit of the money was coming right here in the Wake County, and some of the money was being held up, being just sort of frozen, waiting on projects to maybe end up needing to be developed, but it was being frozen instead of being used in smaller areas in other areas of the state in my division. So those counties we were able to get more funding to. We were able to get, even Durham was being left out. And we got their East End Connector funded. And we just tried to make sure that the way that I feel in governing or representing people, you try to make sure that everyone benefits from the tax dollars, because the tax dollars are not government money. They're our dollars. They're the taxpayers' money. So that money should go back and be fairly spread around to both urban and rural. So transportation needs, we got that done while I was serving on the board. As governor, I want to see the areas of the western part and the eastern part of the state continue and to get more infrastructure opportunities for roads and improvements. Also, our urban areas, we got to understand that, don't try to run down the fact of this light rail situation. Some of the opponents say that we don't really need light rail. Well, go to Charlotte and see how Charlotte has done with their light rail that they've had there, and look at what we're going to try to do in the Triangle area. To get so many of these cars are just on these roads and just have us waiting in traffic hours at a time to go to work, to get a job. Now, I got those lanes increased on I-40 coming from the Research Triangle Park, going out toward Cary and going out to other parts of North Carolina. It had been 2 lanes. We got it 3 lanes. Now here they're going to make it 4 lanes. But I tried to get that done because when I would be coming back from the legislature, and then when I would be coming back from the Board of Transportation, I would go there and see cars stacked up from Durham that are trying to get all the way over to Raleigh and to Cary, just locked in traffic. And so that we can do better in North Carolina, and you know that as well as I do. We used to be considered one of the top states for transportation and highways in this country. That's why I'm saying we have fallen back, and unless somebody's going to speak out about it and accept the fact that maybe we have not done as well as we should, but let's see what we're going to do to make sure we do better. That's what leadership, I feel, is all about. Not just making decisions when it's popular.
Now, the President General Assembly has decided that transportation, and they have committed to more spending, but they've adopted a policy of pay-as-you-go. Mm-hmm. Should we have a big bond issue and take care of our transportation issues now while interest rates are low?
Well, let me say, I have to commend the General Assembly for doing this. They, in this last session, they decided that they were no longer going to let the money that's supposed to be for transportation from the gasoline tax and all, the people in the General Assembly were using a good bit of that money that's supposed to be for the Department of Transportation. They were using that money to help balance the budget. So they took that provision out now. So that money is going to be going directly to the Department of Transportation. And let's see what that's going to do in regard to helping to be able to create more highways, more roads, and take care of the infrastructure that we have. So I do think there have been some improvements. Would I like for there to be more improvements? Of course. I look over in the Charlotte area, they've got a terrible situation there. I think they're now going to try to make that a toll road, and there's a lot of disagreement about that and all. But let's look at both the urban and the rural parts of the state, and let's make sure that we are visionary and that we go about it in a very comprehensive and careful manner to make sure that we are spending the funds that we already have.
Our guest is Ken Spaulding, who is a candidate for the Democratic nomination for governor, subject to the primary in March of 2016. And we will be back with more right after these messages.